Millions of COVID-19 vaccine doses now administered in the U.S. each and every day. But still this morning, new fears of a potential fourth wave as variants spread and restrictions are rolled back. The nation itching to return to normal. The big question, can we? To answer that question and so much more, please welcome back to the PIX11 Morning News, the nation's leading infectious disease expert, Dr. Anthony Fauci. Dr. Fauci, thanks for returning here.
My pleasure. Good to be with you.
So, Dr. Fauci, I want to begin with the case numbers, right? The country seeing more than 36,000 new cases just yesterday. New York, New Jersey seeing a rise in cases and hospitalizations coming off of Easter and Passover where people gathered. There is this fear now of a potential fourth wave. What can we expect in the coming weeks and months? Are we nearing a fourth wave?
Well, it's really a critical time, actually, because it's sort of a race between getting people vaccinated and this disturbingly high daily count of cases. You know, you said there were over 30,000 yesterday, but that may have been a spurious drop because of the Easter weekend. A couple of days before, it was as high as 60 to 70,000 new cases. So there is a risk of a surge. But I think there are two things that would help us to avoid a surge, or at least a surge, if it does occur, much, much different and much more muted than the ones we've seen in the past over the last year.
Right.
And that relates to continuing to do as well as we've done. The other day, we had 4 million people who were vaccinated. That's really quite impressive, together with not pulling back prematurely on our methods of public health mitigation. You know, we understand the COVID fatigue that people have wanting to get back to normal. But if you pull back on things like mask mandates and restaurants and bars and things, you do have a danger of having that surge occur. We just need to hold on a bit longer, because every day that we get 3 to 4 million people vaccinated, we get closer and closer to have a broad umbrella of protection over the community.
Understood. That brings me to the conversation and variants, right? Data emerged last week linking 70% of new cases in New York to variants. Does the data in any way indicate that the vaccine may not be protecting against these variants?
Well, the data we have so far indicates that the vaccine-induced antibodies work very well against the B.1.1.7 variant. That's the variant that originated in the UK and that's rapidly becoming dominant in the United States. So in that regard, we're doing pretty well, that we're fortunate that the vaccines we have that are highly efficacious do well against that variant. There are other variants around that we keep our eye on, that there may be some diminution of effect of the antibodies. But for the 1.1.7, we're in pretty good shape.
So is there any indication then of how long the vaccine will last? I think that's a big question people are asking. Will this be a yearly vaccine? When exactly would we know?
You know, we don't know until the time evolves that will give us the answer, because we do know as long as we've been looking, which is anywhere from 6 to 8 months, it looks like the effect of protection is durable. Almost certainly it's going to diminish over time. We don't know how long that's going to be.
Does that mean you need the booster? Do you need a booster at any point?
We may need it. That's the point. But we don't know exactly when, because we don't know when it gets to the point where it gets below the level of protection. And that's the reason why you follow people very carefully and you measure these correlates of immunity to see how long they last. And if they start to diminish below a critical level, then you start thinking about the possibility of boosting. And that's the reason why we're already doing studies right now, looking at boosting and looking at the effect. So we're ahead of the game in the sense of asking the question to get that answer before we really need it.
Understood. You know, last week, Dr. Fauci, the CDC director, described this feeling of impending doom, right, as she watched the numbers rise. But by week's end, the CDC said we can travel if we're fully vaccinated. So please help us navigate this. Do we hunker down to squash the numbers and bring that plateau even lower, or do we book travel?
No, what Dr. Walensky was saying is that as we get vaccinated, there are certain things that we can do now that we're vaccinated. So even though in general, she says only do necessary travel, because travel does give you an increased risk of infection. But the point that she made is that if you're going to travel, the fact that you are vaccinated means you don't have to get tested. before and after you travel, except if you have a destination that requires it. When you come back, you don't need to quarantine yourself. So the point that she was making are really quite compatible with what she was saying. She was just saying there are some advantages right now to getting vaccinated of things you don't have to do if you travel, even though in general, we discourage people from anything other than necessary traveling.
Understood. So what does that mean then for the parents who are trying to plan their summer vacations, send their kids to summer camp, or simply want to go to the playground? Should they, if their kids are not vaccinated?
No, I don't think you should, in fact, look at children being vaccinated as being anything in the way of what you want to do. It really depends on what the level of infection in the community is. If you look forward, you ask the question, what's going to happen when you get to the late spring, early summer? That's really going to depend. I mean, if we get a substantial proportion of the population vaccinated and the level of infection in the community gets to a very low level, certainly lower than the level it is right now, you're going to start seeing the capability of doing things in a much more flexible way during the summer. That's the reason why when the president himself said, you know, if we stay on the schedule with the vaccines, by the time we get to the holidays, such as the 4th of July, we'll be able to do many, many more things in a more flexible way than we do right now.
I think people like to hear that, right? But Pfizer, speaking of kids, announced that its vaccine is 100% effective in kids in their trials, ages 12 to 15. Parents are looking for you, doctor, to walk us through the timeline for when they'll be able to see their kids get vaccinated.
Right. That's an obviously good question, and there is an answer to that. Almost certainly that we'll have kids of high school age vaccinated by the time we get to the fall term. Several of the companies, including in collaboration with the NIH, with my group here, are doing what's called age de-escalation studies, namely taking a look at whether the vaccine is safe and induces an appropriate immune response in people at diminishing ages. We know 12 to 15, as you said, 100% effective. That's the reason why high school kids, when they return to school in the fall term, they should be able to get vaccinated, all of them. When you get to younger children, 12 to 9, 9 to 6, 6 to 2 years, and 6 months to 2 years, by the end of this year, certainly by the beginning of the first quarter of 2022, we should have children vaccinated at virtually any age.
So those kids who are not going to be vaccinated until the end of the year, but their grandparents are vaccinated, can they see one another?
Yes. Yes, that's great. Definitely.
That's great. That's good news because, you know, I know you want to hug your grandkids, right, sir? So many grandparents want to hug their grandchildren.
And absolutely. In fact, the CDC and their recommendations about what you can do when you're vaccinated use the example you gave as the prototype example. If you have a grandparent who's vaccinated and they want to visit their daughter or their son and their grandchildren and they are not vaccinated, they can do that, so long as the children and the grandchildren don't have some underlying condition that makes them very susceptible to a severe outcome. But if they're generally normal, healthy kids, absolutely grandma and grandpa, if they're vaccinated, can visit.
You know, I think you'd be proud of your former Bensonhurst, Brooklyn neighborhood and so many neighborhoods right now because they have been wearing masks and doing so for so long, Dr. Fauci. You've encouraged mask wearing, even if you've been fully vaccinated. A lot of talk, though, about when people can rip that mask off if they've been fully vaccinated. You know, I'm going to ask you to take out your crystal ball here. When can they do that?
You know, we'll be able to do that when you get the overwhelming majority of the population vaccinated and the level of infection in the community is extremely low. When you get to that point, you will reach what we referred to as this terminology of herd immunity, which means there'll be very little infection in the community. When that occurs, you're going to see being able to pull back on many of the public health mitigation methods that we talk about, including mask wearing.
Almost out of time here. I want to squeeze in one more question for you. And there's been confusion, though, about whether or not you can be a carrier if you've been fully vaccinated. Can you please set the record straight here?
Yeah. The answer is theoretically you can. In other words, you can get vaccinated, be protected against clinical recognizable infection, still get infected, and theoretically be able to transmit it to somebody else. However, as time goes by, more and more data that we accumulate strongly suggests that that occurs very rarely. And even when it does, it's unlikely that you're going to transmit it to somebody else. We're doing a definitive study now on college campuses to answer that question. When it gets answered definitively, then you'll hear a recommendation that if you're vaccinated, you don't have to be wearing a mask.
Understood.
But we're not there yet.
Okay, good information there. Dr. Fauci, always appreciate you being here. Yankees home opener, by the way, last week, Mets this week. Will you, I know you're a Nationals fan, which I think I'm surprised, being that you're a New Yorker. Will you be sitting? Will you be in a stadium?
No, unfortunately, the nature of my job is not going to allow me to do that for a while, but I'll certainly check it out on TV.
There you go. And you know, Yankee and Met fans, they're gonna have a problem with the Nationals, you know. Just saying.
Yeah.
Just saying. Dr. Fauci, great information. Thanks for being here on PIX11 again.
My pleasure. Thank you for having me.
All right.